Hello everyone, my name is Archana Paul, lecturer from Pravara Medical Trust, College of Pharmacy, Shevgaon, and my subject is Pharmaceutical Chemistry 2nd. So our today's next topic is general anesthetics. We have to see the definition of general anesthetics, classification of general anesthetics, and various general anesthetic agent. So first, what is the definition of general anesthetics? The general anesthetics are the CNS depressant drugs which produce a partial or total loss of pain by loss of consciousness. They are known as general anesthetics. Means these are the agents or the drugs which are the CNS depressant and they produce partial means half or total loss of pain by loss of consciousness. We have seen in local anesthetics that local anesthetics are the agent which are applied locally on particular area, but they act by not loss of consciousness, by not producing loss of consciousness. They are known as local anesthetic. But here we are studying general anesthetics. In general anesthetic there is a total loss of consciousness. Means these are the drugs and chemicals which produce anesthesia, a condition in which there is a loss of sensation of pain and loss of consciousness. They are known as general anesthetics. Next we have to see the classification of general anesthetics. General anesthetics are divided into two types: inhalation anesthetics, means they are the volatile agents, and intravenous anesthetics, they are the non-volatile agents. These inhalation anesthetics which are divided into again two parts. First is the volatile liquid and second is gaseous. The example of gaseous are cyclopropane, nitrous oxide. And the intravenous anesthetics are divided into again two types. They are ultra short acting barbiturates. The examples are Theopantone, Theopantone and sodium methohexitone. And second, non-barbiturates. The example of non-barbiturates are ketamine, althecin and propanide. Then these volatile liquids are again divided into two types. They are the ether derivatives and halogenated hydrocarbons. The example of ether derivatives are anesthetic ether and vinyl ether. And the example of halogenated hydrocarbons are chloroform and halothane. So this is the classification of general anesthetics. Then our first agent is halothane. Here is the structure of halothane given over here. The chemical name is 2-bromo-2-chloro-1,1,1-trifluoroethane, or we can also pronounce it ethane 2-bromo-2-chloro-1,1,1-trifluoro. So properties of this halothane are: it is a colorless mobile volatile and heavy liquid. It is non-inflammable and it does not form explosive mixture in air. Means when it comes in contact with the air, it does not form any explosive mixture. It is slightly soluble in water but miscible with absolute alcohol, ether and chloroform, and it boils at 50 degrees Celsius. So these are the properties of halothane. Then next is stability and storage of this halothane. So as it is decomposed slowly in exposure to light and it is also affected by air, so it should be stored in tightly closed light resistant container at a temperature not more than 25 degrees Celsius. Then where we use this halothane? So it is used as a general anesthetic in surgical operations and obstetrics practice. It is used by obstetric practice, means it involves care during preconception and pregnancy and also immediately after delivery. They are known, that is, the care is known as obstetric practice, and it is also used in general anesthetic. The official preparations are halothane, British Pharmacopoeia. The brand names are Halothane and Theopantone. So this is all about halothane. Then our next agent is cyclopropane. Cyclopropane, it is a colorless inflammable gas having a characteristic odor. It has a pungent taste. It is freely soluble in alcohol and it forms explosive mixture in air. Means when it comes in contact with the air, it forms an explosive mixture. It is almost colorless, it is an inflammable gas, and it has a characteristic odor. These are the properties of cyclopropane. Then stability and storage of cyclopropane. So you can see here the image of storage. It is stored in a metal cylinder designed to hold compressed gas and kept in a cool room free from inflammable material. So it should be kept in a cool place, and there should not be other inflammable material present in that room, and the whole cylinder should be painted with orange, and the name or chemical symbol of the gas should be stenciled in a paint on the shoulder of the cylinder. Means there should be a name or any chemical symbol of that gas should be present on that cylinder. The uses of this cyclopropane are, it is the most potent gaseous anesthetic. Means it is, we have seen in classification that gaseous anesthetic, the examples are cyclopropane and nitrous oxide. So it is a most potent gaseous anesthetic, and it has an analgesic property as well. So this is the use of cyclopropane. Then our next agent is diethyl ether. So this diethyl ether, it is a colorless, clear, very mobile liquid. It has also characteristic odor and sweet burning taste. And this diethyl ether, it is very volatile and it is inflammable. The one part of this diethyl ether is soluble in 10 parts of water, and it is miscible with alcohol, chloroform, benzene and fixed oil. And when it comes in contact with the air, it forms an explosive mixture, and it is slowly attacked by ordinary oxidizing agent. Then the stability and storage of this diethyl ether are, it is oxidized by oxygen and affected by light, so it should be stored in well closed tight container and protected from light, and should be kept in cool place. And the label on the container should state that it is very inflammable gas. Do not use near the neck flame, means it should not be kept near to the neck flame. It is very inflammable, mobile liquid. And the name and the proportion of any stabilizer added, means if we have added any stabilizer, then it should label on that particular storage container. The uses of this diethyl ether are, it is an anesthetic ether, it is used as a general anesthetic. Solvent ether is used as a solvent. The official preparations are anesthetic ether, BP and IP. So this is all about diethyl ether. Then next is methohexital sodium. This methohexital sodium, it is a white powder, it has a faint color and it is soluble in water. It is used as a anesthetic by induction of, it is given intravenously to the patient. Then our next agent is Theopantone sodium. So this Theopantone sodium, it is basically a mixture of sodium with anhydrous sodium carbonate. It is a yellowish white powder. It has a characteristic odor and has a bitter taste. It is freely soluble in water and practically insoluble in an ether, and it is hygroscopic. So as it is hygroscopic and it is decomposed by atmospheric oxygen, so it should be stored in tightly closed container. The uses of this Theopantone sodium are, so it is used to induce general anesthesia, means it is used to produce general anesthesia. It is used as an anticonvulsant, means in epileptic seizures, means there is a abnormal excessive activities in brain. And it is also used for prevention and treatment of cerebral ischemia, means there is a blockage in an artery which restricts delivery of oxygen rich blood in the brain, and it has a poor analgesic and muscle relaxant property. The official preparations are Theopantone sodium injection, and the brand names are pentothal sodium, intraval sodium. So this is all about Theopantone sodium. Then next is trichloroethylene. It is a colorless or pale blue transparent mobile liquid with chloroform like odor. It is very slightly soluble in water and it is miscible with absolute alcohol, ether and chloroform. And the stability and storage of this trichloroethylene is, it is stored in tightly closed light resistant container in a cool place. And the uses are, it is used as a general anesthetic, it is used by inhalation for analgesic in obstetrics, it is also used for extraction of oil and fat, and commercially it is used in dry cleaning industry. So these are the uses of trichloroethylene. And the official preparations are trichloroethylene and the brand name is Trilene. So this is all about trichloroethylene. We have just covered general anesthetic topic. We have seen cyclopropane, Theopantone sodium, trichloroethylene, diethyl ether, halothane. So thank you so much.